Welcome to Dentist in the Know. We are the podcast where dentistry meets real talk, real news, and just the right amount of sarcasm. We pull back the curtain on the industry. We talk to the experts, the innovators, and the everyday clinicians who are out there doing the work. No fluff, no filter, and definitely no sales pitch disguised as education. If it's happening in dentistry, from clinical breakthroughs to regulatory curveballs to the latest scandal at the ADA, we're probably already talking about it. And yes, we're bringing the receipts. So whether you're a seasoned doc, a curious consumer, a rep, a researcher, or just here for the drama, welcome to the show. Because around here, we're not just in the loop, we're in the know. And I am Chad Duplantis, and it is an honor to be here with you tonight. I am with tonight a very special guest, Dr. Tanya Sue Maestas, who is one of our El Paso, Texas. And you know, StreamYard just did this thing here that I can't figure out for the life of me how to make us larger on the screen, Tanya. But I know you're here. You know I'm here. How are you doing?
I'm good. This is what the dinks get for leaving you alone with technology, which is what we're going to be talking about today. So I'm a little nervous here.
I know. We are going to be talking about technology. There's a lot that we're going to be talking about. And I'm really excited because you sent me a text right before the show and asked me, you know, we're going to talk about this, we're going to talk about that. And of course, I said, yes, we're going to talk about this and we're going to talk about that. However, we're going to talk about something that you really didn't know. There we go. I got it figured out. Holy crap. I'm sitting here trying to figure it out. You don't know what we're going to talk about, but you and I just did something very similarly over the past few weeks. So we're going to talk about that as well. And I'm going to surprise you with that. Yeah. So I tell you what we're going to do.
Tell me.
How's your week going? Let's talk about that first.
Yeah, it's been busy, but it's been good. How's yours?
It's been good. There's a lot going on, but it's good. It's good. We'll talk about that too as time goes on. But we have an associate dentist that started with us a couple weeks ago. She is relatively new out of school, but she also is she's finishing, I guess it's in the midst of her third week of clinical practice. And she's just doing phenomenal. I'm so proud. It's really cool, you know? And, you know, everybody's always like, what are you going to do with a new graduate? And you and I both know that somebody took a chance on us, right?
That's right.
So
we have a new grad that just started with us too. I pitched a dental student that graduated. She started last week and second weekend. Super awesome.
Well, there we go. We're about in the same boat. But one thing that I've noticed is that the confidence level has just increased so dramatically over the first week and a half. And I don't mean that negatively. It's not like, she can't get through the door with her head anymore because she's got such an ego, but it's just like, you can just see that confidence really building and kind of the excitement to be there and the lack of fear and trepidation when they walk in there with a patient. Have you seen that as well?
Yeah, 100%. I think the first week is like, oh, what is this? This is different, new territory. And as we all did, you kind of build into your skin and kind of get more comfortable, learn to talk to patients. And it's just a different atmosphere that you have to get used to. But I definitely am seeing that, which is really cool.
There were things that I was impressed with the first week for sure. I think that I would say that there were more things that I was impressed with the first week that I anticipated being impressed with the first week. Of course, once again, I don't mean that negatively, but as we've gone on, I've just been so impressed with how she's coming into her own. So it's been really, really exciting. So
I think she's in a really good practice too. I think that you have a lot of cool toys and gadgets, great mentor, really nice place to be. So as long as no homeless people walk in and start to terrorize.
That's my new favorite phrase, is that I don't want to be an educator. I want to be a mentor. I don't want her to feel like I'm over her shoulder checking her preps, right. But I want her to know that I'm there in case she needs a bailout or a little bit of help or something 100%. Like that as time goes on. So let's get some news, and then I'll do a formal introduction of you.
Let's do it.
Then I will we'll talk technology. So hold on just a second.
Sweet.
All right. So folks, I do have a couple of news stories that I want to share this week. As you all may have received the email from the ADA a couple weeks ago or last week, I think, there was a lot of uncertainty as to what the ADA is really doing for us. But, I want to be here to say that I've been a member of the ADA since I started. I'll always be a member of the ADA unless they do something drastically crazy. But I feel that organized dentistry is very powerful. It's something that we need. I think that they're doing the best that they can with what they have. But this may improve your outlook on the ADA. So the ADA went to bat for us as dentists recently. This article was published on the 11th of July. And they went after an insurance company, and I can say the name because it is clearly stated on the ADA's website. And they went after MetLife. And what they did is they had received reports of MetLife reducing or offsetting the payments owed to dentists to recoup overpayments allegedly made to other unaffiliated dentists. So basically what it sounds like to me is that MetLife would have overpaid a dentist. Another dentist, totally unrelated to the first dentist, is treating another family member totally related to the first family member. And what they would do is they would discount the patient to recoup their overpayments on the policy to another patient of the same family at another dentist. It's rather confusing if you listen to it and try and read it. I was as confused as you are, but basically the ADA said that's something that you shouldn't be doing. And I'll be doggone if MetLife didn't come back and say, you know what, you're correct. We're going to change our policies to only offset claim overpayments from the provider that was overpaid. So I think that we would think that this is pretty much the way that things should be. However, they aren't the way that things were. So the ADA came out, fought MetLife for us, and MetLife says, oh, we're going to do something that has a little bit of common sense and only reduce payments to the provider, to the same provider rather than to a different provider. You would think it's logical. Now it is logical, but I just want to give a shout out to the ADA for fighting for us and doing what's right. All right. Second bit of news. This is something rather interesting, but if those of you all that might be like me and somewhat of journal junkies, there is a new publication called the International Journal of Applied Health Behavior Change. It launched last Friday, July the 18th, and it offers a unique platform for dental hygienists to showcase how changes in their own behaviors and communication styles can profoundly influence the oral health outcomes of their patients. Basically, if you read through this, I think this would be a great journal for people to read, to learn how to communicate and improve outcomes that we provide within our practices, and also improve the way that patients receive the information that we provide to them in order to improve their oral health. So I'm always a proponent and a fan of a new journal that's out there in dentistry, and this one is once again called the International Journal if I can talk, the International Journal of Applied Health Behavior Change. It launched last Friday, so be on the lookout for it. Secondly, or thirdly, I guess, this is our third bit of news. This is something that I found interesting. And one of the reasons that I find it interesting is that Spear Education has been a longtime supporter of Dentists in the Know and our platform. And they are launching a foundations program for new dentists. So I'd like everybody to just take a second, look into what Spear Education offers. I have, if you listen to our intro, I have a new dentist in my practice. Dr. Tanya Sue has a new dentist in her practice. And I think that the industry is lacking in ways that we introduce these new dentists to our profession. And so Spear just launched a foundations membership, which is a self-paced training and support program, and it's designed specifically for dentists in their first 5 years of practice. So this is something that I want to get our new associate involved in, and something to look out for any of you who may be bringing on a new associate, or if you're just new to the practice of dentistry, look into what Spear Education has to offer. I've been a Spear member for years. I love their educational platforms, and I think this is just a wonderful tool for us to use as seasoned dentists, for the young dentists coming into our practice, as well as, once again, for the young dentists just entering the profession. And finally, another little bit of ADA news, and this is near and dear to myself and our guest tonight. And this is from the ADA, and it is a guide as to how all of you out there can help the unfortunate people that were affected by the floods in Texas on July the 4th. There is a great resource. I'll publish it in the comments in just a few minutes as to how any of you who are wondering how you could be of help to the 129 people that have died. That's at least number, and more than the 170 that remain missing as of July 13th. These are the people that were affected by the flash floods in the Texas Hill Country region on July the 4th. There's a great resource from the American Dental Association and the Texas Dental Association of various ways that we could help and donate the organizations that are involved, and ways that we can really make an impact and really say that we did something to improve the outlook of this horrible situation that occurred at the beginning of July. And so I know that my news is not nearly as good as Dr. Jennifer Bell's news, but that's what you get when she's gone and you're stuck with me. And so there you go, folks. Look for that in the comments. I will post it in just a minute. And we would love to have you all help our flood victims in Texas, as well as look into the other stories that we talked about tonight. So thanks to the ADA for their great efforts, and thanks to Spear Education, and look out for the new journal that I published. And with that, that's the news. And I am going to bring our guest, Dr. Tanya Sue Maestas, to the stage. But before, or as I bring her to the stage, I usually tell Jeff, I'm like, I'm going to bring him to the stage, and I can't do two things at once. I don't know if your father ever told you this, but my dad was great at telling me that I couldn't walk and chew gum. But tonight, I am going to walk and chew gum, because I am going to introduce our guest.
Very good.
Our guest, all I really want to say is that I am honored to be a friend of Dr. Tanya Sue Maestas. She's been a great friend of Dentists in the Know. She's helped us out on numerous occasions, and we just locked and loaded her for Chicago 2026. But Tanya attended the University of Texas School of Dentistry at Houston, After being raised her entire life in El Paso, Texas, she graduated in 2018. So here she is 7 years out, completed an AEGD residency at the same school in 2019. She became involved in organized dentistry and still is. I mean, this young lady, all 4'11" of her,
Yeah.
was racing around the Texas Dental Association, trying to fight for all of the dentists in Texas. She's very involved with the ADA, but now she is still involved in the health of others. Of course, you say, aren't we all? Well, she is on a different level because she works for the Indian Health Services at Isleta del Sur Pueblo Indian Health Services Clinic, part-time in El Paso, Texas, and she is dedicated to improving the health of those. It's my understanding that this has been a great move for her, and we're going to break that apart and talk a little bit about what she's doing. But welcome, Tanya.
Thanks.
How are you?
I'm actually full-time there, Chad, but I am part-time at the dental schools.
Okay, here's the deal. We're going to break this down because I love you a lot. But right before the freaking show, you sent me in one sentence,
I did.
Isleta del Sur Pueblo Indian Health Services Clinic, part-time faculty. What the hell am I supposed to say?
Get it together, Chad.
Like
Get it together, Chad. Learn to read.
Where
are your glasses? It's because you're missing the glasses.
No. Those were my actual glasses. I don't have my contacts in, so now I have to read without my glasses on. It's a really screwed up world. Wait till you hit 50. It's a different world. But I apologize. Let me back up.
No, don't apologize. I just a small correction.
Full-time at the Indian Health Services Clinic and part-time at the University of Texas Dental School at El Paso.
It sounds like I'm only a part-timer in general. No, I work, Chad, okay?
Well, I was kind of wondering the same thing. But hey, speaking of which, before we dissect what you're doing I think this has a lot of validity to what we're talking about tonight. Tell us a little bit about the dental school at El Paso. It's kind of unique, isn't it?
I mean, it's in El Paso. No, I'm kidding.
Come on. It's very digital, right?
Yeah, very digital. Yes.
Yeah. So talk about that.
Analog.
Tell us what it's like.
It's all digital, no waxing, which is kind of crazy. They come in and they learn everything digital, no amalgam whatsoever. They're in the clinic their first year. So it's really cool. They have unique and really cool state-of-the-art technology. There are scanners, there are printers. So it's great. They come out really ready to jump into the digital workflow and the digital world, which is really great. Their analog experience is more of an elective. So they do get the opportunity to learn, impressions, and I think they get to see a little bit of amalgam, but it's not to full scale on what we all experience in dental school. So it's definitely a different experience for them. But for those who graduated in May, having that opportunity to be in the clinic with them, half a day a week, I really saw them grow in those 4 years and really feel comfortable with the skill set that they learned and are graduating with.
So I have a question regarding that. And you and I, there's maybe like 3 years that separate us in life. I mean, hey.
Oh, for sure.
Maybe 4. Okay.
Yeah.
But no, with that being said, I think this is a great segue into what we're going to be talking about tonight. And we're going to be talking about digital workflows, technology, and integration of technology into your practice. But we're going to do a little bit of a point counterpoint. And you are involved in this on a almost daily basis, since you are just part-time at the dental school. I'll make that clear. But you're involved in this on an almost daily basis. You learned how to wax in dental school, right?
Oh yeah, 100%.
Okay. So let's start right there. How do you feel about going entirely digital with no analog preface?
So I think, I don't think, I personally don't think waxing is necessary. I think you can learn the dental anatomy in a different way. That being said, I do think there's still some value in learning how to take a crown impression, pack that cord, and learning to read the margin on a PBS impression. I think for me, that's probably the biggest pain point that I could foresee these new dentists running into. But other than that, I think that you can kind of learn it on the job. But that's probably the biggest pain point I think that students will run into. That's specific.
That's interesting. I'm not going to say that it's wrong, but I think that there was so much value in waxing. And, I think there's value in analog art. I think there's value in digital art as well. But I think waxing really taught me those primary, those secondary, those tertiary grooves. It really taught me so much about the anatomy of teeth. I mean, did you have that little red waxing manual that was like a little binder book? Did you have that in dental school?
No.
Okay. So it's funny. I mean, my first boss in dentistry graduated in 1983, I believe. And Becky, if you're watching tonight, I apologize. I know it was 83 or 87, but I'm going to go out on a limb and say it was 83 because you are a tad bit older, I love you, than my partner, Ken, who graduated in 87. But when I left for dental school, she took her old waxing manual down, and I wish I had it behind me to show you. I'll have to post a picture in the comments tomorrow. But it's like this little like 3-ring binder. And when I say little, it's like postcard sized. And you open it up and it has, the various teeth and the talks about the anatomy and stuff. And so she wrote me a little note inside there right before I started dental school and gave me hers that she had her freshman year of dental school. And so we got to dental school and I thought I had the coolest thing ever. I mean, here I am starting dental school 12 years after she graduated, 17 years after she started. And I had the same damn book. I mean, the exact same book, same pages. And so we didn't learn anything different, as far as waxing is concerned, but I just felt that there was such a foundation to waxing. And then when it comes to impressions, I mean, I've taught digital impressioning since 2012.
Mm-hmm.
And my biggest mantra has always been that, whether you're analog or whether you're digital, the principles remain the same. So, becoming digital isn't going to make you a better impressioner or impression taker or whatever you want to call it. But you have to understand the fundamentals of impressioning. So I don't think they need to spend a lot of time on it, but I think that there's got to be some analog. That's just me being old school. But then again, I don't know what it's going to be 20 years from now. They're going to, so do they start with ExoCAD or what do they start with?
Yeah. No, and that's something that I think those students that graduated this year didn't really get a lot of experience in was design, which I think is another pain point that they're going to be faced with, right? Because when you come out of practice, if you do go into a digital practice, it is likely that you're going to be designing your own crowns, right? And I think that that's where a lot of the dental anatomy really comes in. Where should you put your contacts? How should the anatomy look? But I still think that you can learn it with composite. And so I'm all for when placing composite, placing anatomy in there. And I really strive to do that. But how many of your restorations have tertiary anatomy?
Well, if they come from the lab and there's zero adjustments, they all do, but the counterpoint on that is like, let's think of it this way, because this is going to happen to almost every single one of us. And if it doesn't, then I'm just going to say it out loud. You're a liar. Where you get this crown that comes in from the lab, or you created it, CAD CAM, and it's just absolutely beautiful. And then you go to put it in and the patient's like, that's the only thing I'm hitting on. So you grind a little bit, then you put it back in, you grind a little bit more, you put it back in, you grind a little bit more. And next thing you know, there's zero freaking anatomy whatsoever, right? So what do you have to do? I don't know. I'm anal. The first thing I'm going to do before I polish that restoration, I'm going to put anatomy right back in it.
100%, for sure.
And so, the thing is that I still think that you've got to understand it. Do I put tertiary anatomy in it? No, but I'm kind of a stickler. I do put secondary anatomy into it. I mean, I really take a little time to make it look like it came back from the lab, because I almost feel like if I get in there and I, whether it's my fault for a bad impression, digital or analog, or the lab's fault for, not paying attention to the occlusion that I provided. I mean, it's neither here nor there. We got to fix it.
Right.
And not everything's a complete redo, but I want it to look the way that it was intended to.
Yeah, no, I completely agree. Agree. But I don't think waxing is the only way to learn that.
Well, I'm not saying that it is, but I'm just saying that's where I learned it, you know?
Oh, sure.
And so that's where I'm like, that's the old dog, you know? I
That's
feel
so
that
interesting to me because I mean, you're a digital dude, you know, like you have embraced that workflow. And so it's
I
so
am.
interesting that, and there's a lot of more seasoned dentists who would agree with you, right? Like
Yeah.
I think the school got a lot of pushback and a lot of commentary that came in when they heard that they were going to be fully digital. They said it just couldn't be done. And I think that there are still struggles as well too when it comes to denture workflows. I think we're getting there, but no impressions
I
can be challenging.
I can't say that I disagree with you there. I'm gonna totally agree with you there. But it's also funny because I talk about this too, and I laugh about this often. I'm gonna give a shout out to one of my good friends in the area that you might have heard of, but Dr. Chad Perry. Do you know Chad?
I don't think so.
Chad is a wizard, and man, I always joke with him because he will do these beautiful composites. And I wish Chad was on the lecture circuit more. He publishes occasionally, he should publish more, but I mean, he will do these composites. He'll stain the grooves and everything. And I mean, they look like natural teeth. And I'm always like, Chad, they came to you to get the stains out of their teeth. And here you are putting the stains back in their teeth. What the hell's wrong with you, But it just cracks me up. So tell us a little bit about what's going on in your office.
Sure.
And I'm gonna ask you to maybe start with the simplest innovation that you added, and then let's go to
Sure. So I'm gonna backtrack a little bit because I'm in the public health realm. My first 5 years of practice were at a FQHC, very, very analog. And for me, coming out of dental school, they were just incorporating some of those digital workflows. So even being 7 years out, they were just kind of incorporating that. And so we knew what a scanner was. We could scan, and I think one of our requirements was to mill a crown. So I knew a little bit, worked in a FQHC for 6 years. Everything was analog. And this opportunity presented itself at this Indian Health Service clinic, which I had interviewed at when I first came back to El Paso, but there was no vacancy. So it seemed like the right opportunity. And I went ahead and took the job. So one of the first things that I got to experience, which I think is probably a very big introduction for most people when they're diving into digital dentistry, is a scanner and a mill. So we have a CEREC scanner and an MCXL. And so I jumped straight into learning from Dr. Klim online. He's got a great platform, really good stuff, great YouTube videos. And I'm still learning because I don't think I know the entire, I think there are lots of great options that you can choose from on the scanner. So I'm continuing to learn, but I know enough to get by. I know enough to tinker and to troubleshoot and love Emacs. Been dabbling into GC Lissy, which has been really, really cool. I know what to do when I have a margin that's open or that's short. Definitely makes you a better clinician, right? You really want to make sure those margins are nice and clear for your scanner to pick up.
You just shove a little glass ionomer in there where the margins are short, right?
Absolutely, for sure.
Or IRM.
Yeah, absolutely.
Okay, that's right.
No, absolutely not. And I've also learned how to be a technician because those machines can sometimes break down and you have to kind of work it out. I've had some trouble with my furnace, with my CS6.
Okay.
Yeah, I had to run a calibration, and the calibration was causing the crowns to shrink. And so I had all these. I was milling 2 crowns. I got to the point where I was milling 2 crowns. I was milling an Emacs crown and a GC Lissy crown, and trying to compare the margins. And so just throwing money out the window, but really trying to figure out what was going on. I think I fixed the CS6, but time will tell.
Well, do you stain and glaze?
I do.
That okay, so this is also where we differ. I mean, our practice, I would say, is very digital, but my thought process is that although we're very digital, we are very time constrained. I mean, we're a pretty busy practice.
For sure.
So my motto is that if I have to stain and glaze, it's going to the lab. that's where the characterization comes in. So, I do a lot. I really don't mill any Emacs or any lithium silicate products. Glass ceramics, I guess, would be the better word, just to encompass those products. But what I'm milling in my practice is I mill a lot of hybrid ceramics, and I also mill a lot of zirconia. And I feel that those fit in very well in my practice. I do a ton of glass ceramics, but those are all going to the lab because they require characterization. They've got the time. I send them the photos. They're the experts at it. And it's just something that I just really don't want to necessarily dive into. I'm not even going to say dabble, because I really don't
Sure.
even want to dabble. If I had all day, it'd probably still look like crap. So,
I mean, I'm not saying it's beautiful. I like to do it. I think the time constraints are there. But I think it's nice to kind of push that workflow. You build it in, you do your best to pop away from a patient, get in there, stain it real quick, glaze it, throw it in the furnace, and then continue moving forward with another patient in there. I think, for the Indian Health Service population that we see, we're able to see tribal members that aren't from the tribe here in El Paso. And so if we can keep all that work in-house, there's no cost to them. But if we have to send it out, then there's a cost to them. And so I try to do everything that I can to do it in-house and, add that characterization and try to make it look nice. But for me, it's really cool because, I got to work with a lab for those first 5 years out of practice or in practice. And I got to see things that I liked and things that I didn't like. And so now for me, the challenge is, can I replicate that? I haven't gotten close, but it's not ugly.
That's a wonderful comment there. And I just want to pause on that for a second because, I've been I should say dabbling in CAD CAM since 2004, but I really dove all in about 2012. And one of my biggest things is that I always said I would do something same day if I could provide the same or a superior quality than the laboratory. And we both know that none of us are going to sit here and say that same day dentistry is superior to the laboratory, but I think that we are offering a very similar product that we feel very confident. And I don't think that we could always say that from the dawn of CAD CAM. And so I think it's very important that we look at that. We always want to strive to be able to provide a similar product that the lab could. Do you dabble or fabricate any hybrid ceramic restorations?
Not a whole lot, Chad, and mostly because I don't really know how to use them in my hands. And so I'm comfortable with Emacs. I'm comfortable with GC. I know how to bond them in place. I'm assuming that a hybrid would probably be similar. But I know that if I were to mill one, when it comes to cementing or to bonding, I'm going to be looking at that thing and freaking out at the moment.
Oh, you just call me because that's my favorite thing to mill. So let's pause right there. The hybrid ceramics are just wonderful. There's several hybrid ceramics on the market, and the beauty of it is in 2016, I believe it was. Don't quote me on that. So pre your dental school days, the ADA petitioned for the classification of hybrid ceramic restorations, and if they were greater than a certain percentage filled, once again, don't quote me on that, but I believe it's greater than 50 or 60%. All of the ones that I use in my practice are able to be classified as a ceramic restoration versus a composite restoration. So the beauty of it is they take about 6 to 7 minutes to mill. It's all adhesive bonding. So, but if I get into a really large class 2 or class 3 restoration, that's just, well, not class 3, but maybe a class 2 or a class 4 restoration, that involves a incisal edge, halfway broken off anterior restoration, I'll just go ahead and mill because I think that it's wonderful. You could also print that as well. You're also printing hybrid ceramics these days. But where I find that I absolutely love hybrid ceramics is, let's say we've got a teenager coming in. I just had one come in yesterday, peg lateral. I just scan 9 times out of 10 with zero prepping on the lateral. I'll scan it. I'll create a hybrid ceramic veneer. It mills in like 5 to 6 minutes. I bond it on there, and you can cut it back and characterize it by adding, flowable or condensable composite. And the other thing is that there's several composite staining kits out there. I happen to like Shofu. I believe it's called the Light Art composite staining kit. And so you can get this monochromatic restoration on there. And if you use a translucent one, a lot of times you don't have to do anything because it takes that undertone of the natural tooth. You use a translucent cement, and you've got a really nice, multi-shaded restoration. But I'll take that light art and just add maybe some hypocalcifications or maybe some gingival tint to it. They're so fun. And all of that, Shofu's light art is completely light cured. So you just kind of brush a thin layer on there and light cure it. And it's just like watercoloring. It's amazing. So
that's awesome.
I would highly suggest to try the hybrid ceramics. You call me, I'll walk you through the
Yeah,
bonding
let's do it.
protocol
Let's
so
do it.
you
And I think I have some hybrid ceramic material in one of our drawers. I just haven't done it, since it's still kind of new to me, on top of like seeing patients and learning in between. I haven't dabbled in it, but I think that's kind of next for me. Though what I'm really excited about personally is printing. I think that's where I truly see the future of digital dentistry going. And I want to go all in personally.
So you want to print like indirect restorations and everything. Okay. Sure. So I'm with you. I have a little bit of trepidation, and there was a article in the Journal of Prosthetic Dentistry that came out not too long ago that was saying that milled restorations are still better than printed restorations. Sure. So I think the jury's still out. I'm not going to say, I know I've got a lot of really good friends in the industry that would love to just take me to the cleaners right now for saying that, but the article came out. And so I'm not saying anything that isn't published, but I just have a little bit of reservation. I'm going to say that we're headed in that direction. I just want to see a little bit more research before I get into printed restorations. I think they're going to be there. I know they're going to be there. Printing's the way of the future, but I've got a mill that's doing the same thing, and it's so easy to design. I'm just going to keep doing that for right now.
I think that's fair. And I agree. I think that milling is still superior, but I think we're close.
I think we're very close. I just think we need a few more years of research and data on that.
And some of the indirects that I would start with, I probably wouldn't jump into crowns, but quarter crowns, inlays, some overlays, I'd probably dabble into that and see how they respond. And I'd love to see the longevity based on where in our population as well too. I think that would be really interesting for me to see.
I honestly think unless you're casting gold, one of the hardest things in dentistry to do is to temporize a partial coverage restoration. And so I love doing partial coverage restorations. I don't do a lot of inlays because to me an inlay is really just a class 2 composite, but I do a lot of onlays and a lot of overlays. And I think it's just a wonderful service for a patient to where we can actually, keep the good tooth, remove the bad tooth, and really provide minimally invasive dentistry. So I also encourage you to do that too. But you mentioned printing. I think you have a printer as well, huh?
They are going to install it tomorrow, actually.
Oh, you're excited?
Yes, very excited. So we're going to get some Sprint Tray printers. Midas is coming as well. So really excited about that. Yeah, really excited to learn. We're purchasing exocad as well. So going to dabble into that as well. So kind of just learning all at once. And so I told the team, if we're going to make this leap, we're going to go all in and we're going to learn as much as we can. And I'm sure we're going to struggle and fail along the way, but that's going to be part of the journey.
I heard well, let me ask you this. What are you most excited to print first?
Oh, dentures for sure.
Really?
Yeah. What's the population, Chad?
Okay.
Yeah.
So dentures, you're excited about printing dentures.
Yeah. I think it's going to be hard and getting that workflow up is going to be challenging.
Sure.
But that is the space that I could have seen so valuable at the FQHC that I was at, because the finances were so tight for a lot of the patients. Having a scanner and a printer to have been able to tinker with that and at least provide a solution would have been really awesome. The cost was low enough to where, in payments, patients could get it, but it was still kind of hard to see patients struggle to get the teeth that they needed. So that's what I'm most excited about. And in the future, hopefully, encourage these FQHCs to incorporate these workflows so that way they can provide this service to their patients.
So did you see my comment earlier where I was obviously joking, where I said that your clinics that you've worked in, you've never heard the word budget,
Yeah, I
right?
saw that. I saw that.
So that was kind of a
I
little joke.
budget differently, right? Like
Yeah.
I don't
Yeah.
look at some point in time, I will know like our overhead well, but the budget that we do is a little bit different.
Well, it's funny because when I speak, especially on digital technology, I always talk about, finding your why. And, people who have heard me speak probably get sick of hearing me say this, but I think that Simon Sinek, have you read his book, Start With Why?
Oh, yes. It's one of my
If you're
favorites.
not a reader, please.
Oh, it's so good. It's worth it.
At least watch the TED Talk. But, I added several things to my practice. We had a scanner, and then we had a mill, and then we had a CBCT, went through this whole rigmarole of what we incorporated into our practice as far as digital technology ecosystem and workflows, and everything had a why, because we had incorporated technology many years ago, and I didn't have a why when I started, and it was a failure. And so when we got back into it, I didn't realize what I was doing until I read the book, but I started trying to figure out why we needed it. Why were we incorporating this piece of technology? So the hardest for me to find the why was printing. And so in 2020, while we're all sitting on our rear ends and we have no money because the world is shut down because of COVID, I decide that my why is ready to go for 3D printing. So we implemented printing into our office. And do you want to know what the why was?
What was it?
It was that so many people were coming in with a lot of stress in their life. They were cracking teeth. They were clenching. They were having jaw pain. And so I was like, oh my gosh, I can incorporate a printer, and I can start fabricating night guards. And that's my why. I'm going to do this. And so I have the real numbers published. And the first month that we had a printer in the practice, our net profit from the printer was $7,600.
That's crazy.
Now that was about, at the time, 3/4 of the cost of what we implemented into the practice. So there was a huge why and a huge return right away. Now, of course, the amount that we're printing as far as night guards are concerned have died down. But one thing that I also said was, we're getting a printer. It's not going to be cost effective to fabricate models and bleaching trays and all of this stuff. Bull crap. It was so fantastic that we could incorporate the fabrication of models into our practice, because once you get rid of stone, your life just gets so much better. And when you look at a printed model versus a stone model, you'll be like, yeah, why didn't I do this sooner? So yeah, I think that, there's always something that you're really excited, and your why for printing is like, oh, we're going to change so many lives.
I hope so.
With dentures. And you are. But I will tell you, push the boundaries of that printer. And it's not, oh, what can't this thing, or what can this thing do? It's what can't this thing do? And that's what's really just going to open your eyes, and you're going to be like, oh my gosh, I wish we would have had this so much sooner, And so that's my suggestion to you.
Yeah, I'm super excited. I'm excited to push the limits and really see, what we can do, what we can push the same day. I think will be really cool as well too. And so, like today I saw a gentleman and I took all his teeth out. They were down to little nubbins, and we extracted all of them. And he traveled from Lubbock to see me. And he's Native American, not from our tribe, but he's coming over because that's what he can afford. He can afford a trip over to drive over to see us, to have his teeth extracted and a denture fabricated. And so he's, first person in mind that I really want to try this denture workflow out for. If we have to go through a few iterations, well, so be it.
Yeah. And it's also fun to, if you're going to do this, to replicate their dentures utilizing the scanner and the printer, and utilize a second version of those dentures for just an impression tray, if nothing
Mhm.
else. There's so many things that if you just got to be able to think outside the box a little bit. And nowadays everybody's sitting there going, well, we've been doing that for years. That's not thinking outside the box. But for us that have grown up in an analog world and been used to an analog world, it is kind of thinking outside the box. And so there's a lot of, once again, it's what can't this thing do? Push it to the limits. So I'm excited for you. I think that's going to be a lot of fun.
Yeah, I think so too. I'm really excited. So I'm sure I'll put some pictures up tomorrow, maybe record a video when they come in to install, but I'm ready to jump in.
Well, I want to, there's a lot of things that I want to say, but I'm going to save them for the end of the show. I want you to kind of walk us through a few things, but there was something that you mentioned that you didn't know that I was going to bring up, and we were going to harp on for a little bit. But I wish that we were in a room where we had a lot of people in front of us and we could ask for a show of hands, because I would love to see how many people out there are still utilizing air-driven handpieces. So that's a number that I haven't seen. I mean, we know that about, I was reviewing a presentation today for a company that's about to do a webinar, and they asked me to review this presentation. And I saw a statistic today that about 55% of dentistry is utilizing intraoral scanners. I think cone beams is in the 30 to 40% range. I think digital radiographs is in the 70 to 80% range. We have a lot of statistics. 3D printing is still relatively low. I think it's less than 20%. AI is definitely less than 15, but the last statistic that I saw was actually less than 10% of dentists that were using it. I know that number's climbing rather quickly, and that may be much higher now. But what percentage of dentists are utilizing electric handpieces?
I don't know. For me at the FQHC, and I think in dental school too, we had air driven.
Yeah.
That's what I learned on. And so the switch to electric is very new to me as well too. I still feel myself pushing on the rheostat to go faster sometimes. That's not how it works. Not a race car anymore. But it's so different. Cuts like butter.
It's pretty amazing, isn't it?
It's awesome. It's awesome. I think that I'm quicker now with an electric in comparison to the air driven, but I've also been in it a few years longer, so I don't know.
Well, have you ever had a patient that complains about the noise of the drill?
No. I don't know. Well, like just, patients come in and they say that they don't like how it sounds, but no one says like it's too high pitched or anything like that. Is that what you're?
So I mean, granted, all kidding aside, I've got about 20 more years in this profession than you do. So I've had so many patients that have come in and complained about the pitch of the drill, the sound of the drill. And I've had, I can't even tell you how many patients that have said, Dr. D, you need to invent a drill that makes less noise. And so here I am, 26 years into the profession. I'm used to one sound, I'm used to one feel, and I thought, why would I ever switch? Because we tried electrics about 15 years ago, and they just weren't where they were. And one of the things I'll tell you is that no matter who the manufacturer of your air-driven handpiece is, you're going to have a lot of problems. And as time goes on, you're going to be sending handpieces in for repair. You're going to be ordering new ones here and there. The one thing that remains constant is the connection. But the handpiece is always the wild card. And I'm not going to say that that's not the case with electric, but I found myself just getting really frustrated with the cutting ability of some of the older handpieces. And I'm like, we got to buy new handpieces. We got to buy new handpieces. So we finally, switched to electric. And so guess when that switch was?
Don't tell me it was like a few weeks ago.
Oh, no, it wasn't a few weeks ago. It was Monday.
Oh.
So
what do you think?
First week with electrics. Well, we had a wonderful experience with the sales representative for the company.
Okay.
It's a very long-standing company that's been in the industry forever. And she came in, she dropped the handpiece off, she set it up, taught us how to use it. And I knew, within minutes that it was something that we had to have, and I knew that it was the wave of the future. And also, here we are bringing in a much younger, dentist, and that's all
Yeah.
that she had in dental school was electric. And so that was big for us too, because if we look, I mean, the goal in this practice is to hand it off to someone that's younger and that's willing to take the reins of the practice. And so you've got to invest in youth and you've got to invest in yourself as well. But I was like, okay, well, this is the wave of the future. I'm like, why the hell didn't I do this sooner? And I think electric handpieces have changed quite a bit over the years, at least from my first rendition. But oh my God, starting on Monday, I was like, where the hell have you been on my whole life? My whole practice. But you're right. You're more efficient. It cuts just so much better. So much better,
Yeah,
there's,
it's been great. I really like it. It's light.
yeah,
It's really nice.
a little bit bigger as far as the handpiece is concerned as compared to the air driven, but it's definitely changed a lot since we first looked at going down this avenue. But I am stoked. Like I get excited about things. This is something that I'm very excited about, is going to electric handpieces, and a patient's not going to understand that. My wife, she doesn't understand that. That's not something I can get excited about, and not something that she's going to be able to perceive. But that's a huge leap within your practice. And I mean, having done it for 26 years with air driven, I encourage everybody, if you're still air driven, look into electric.
Yeah, no, I agree. Something that you said that made me smile is that, it improves your day and your life. And I think that that's so much of what we do in dentistry from day to day. And so, like, anytime I do like an overlay too, I get super excited about it, right? In my mind, it's a little bit more conservative. You can have fun with it. And so I try to talk to the patient about it. And earlier this week, I told them, I go, it just makes my day fun. That's why I like it so much. It makes my day fun.
So, while we're talking about this, I have a question, because, we talk about onlays and overlays, and I know that Dr. Jennifer Bell just posted that she did an onlay today, and she wouldn't have attempted it without the ability to mill in office, which is basically what I said. It's kind of, counterintuitive, intuitive, temporize the damn things, because those are impossible. But do your patients, pardon my ignorance, do they pay for the services rendered, or
No.
how does that work? Okay.
No. The tribe covers the cost of their care.
Okay, so you have carte blanche as to tell them what your recommendations are, and they really can choose whatever they really want, and money is not an object.
Yeah, within reason, of course.
Sure.
Specialties, there's a little bit more restriction there. Anything kind of outside of the office, there's some restriction. But for the most part, most of the time, everyone's pretty much on board. Still some pushback either way on extractions, especially like,
sure.
People will prey on the disease, don't think their teeth need to come out, even though they're floating in the wind. Well, that's okay. That's patient education. That's my job to, hopefully educate them and try to meet them halfway. But for the most part, it's really nice. It's a cool setup.
So that's another thing that I get asked about a lot, is that how do you, people will ask me, how do you treatment plan or present an onlay in your practice to a patient as far as financial is concerned, or what's better for their teeth? And so, just for the listeners out there that may be wondering how you incorporate that into your practice, one of the things I always tell people is that, I feel that an onlay and a crown, if either could be done, they're going to both serve the tooth very, very well, and they're going to serve you very well. But my goal is to be as conservative and keep as much sound tooth structure as possible. And so in our practice, there's no price difference between an onlay and a crown. I don't want them to make a financially driven decision, be like, oh, well, a crown's cheaper or an onlay's cheaper, I'm going to go with an onlay. I always tell them that if they're okay with it, I'm going to do what's best for their tooth. When I kind of open it up, when I remove, the undermining decay, the previous restorations, and I'm going to really evaluate that tooth, and I'm going to do what's best for the tooth. And it's so I call it a game time decision. And so, patients really like that. But I would just encourage people to just be as conservative as possible and maintain as much healthy tooth structure as possible. Don't just go mow down a tooth because, that's more expensive within your practice, or that's the only thing that you know how to do. Take some education and learn how to do these things. There's no standard prep for an onlay. They're all bonded restorations. So there's no standard prep. You have guidelines, but every single one of them is going to look different. You're
for sure.
never going to prep two exactly the same.
Oh, no. I think the preps are more fun. Things that we enjoy. I think they're so much more fun than crowns, in my opinion. I like to use a rubber dam.
Yeah.
And so for me, it's just nice to keep everything isolated. I tell the patient it's like a top hat for their tooth. Try to keep as much of the base structure as I can and have fun with it.
What's your bonding protocol for an onlay?
So I bond a lot with composite.
Mm-hmm.
I kind of went the biomimetic route for a little bit during COVID, because there was nothing else to do but learn online, and there was a ton of webinars.
Sure.
And so I use a rubber dam, and I'll bond with Clearfill SE Protect and APX composite. Squish it on there, cure it, polish it up. It's beautiful.
So there you go.
There you go.
I brought that to your attention. You know why I brought that to your attention?
Why? Is that how you
Now you know how to do hybrid ceramics. It's a bonded restoration.
Perfect.
The biggest thing is that follow the manufacturer's directions as to how to prepare the intaglio surface. I use a lot of 3M products within our practice, and I use a lot of Voco products.
Mm-hmm.
So I'm going to either use 3M Reliax Universal along with the Scotch Bond Universal as the bonding agent, or I'm going to
bond in the resin. The bond in the resin.
Voco's Bifix QM with Futura Bond. And so and I always tell people that chemistry is designed together to work together. So don't be using somebody's bonding agent and somebody's cement.
Yeah. That's what I was just telling my new dentist. I was like, the companies, they test and they formulate products to work well together. I go, do your best to keep it in the same family when you can, even when you're trying new things.
That's it. So, as I'm looking at the time, we're kind of closing in, and I don't want to keep everybody longer, but I do have one final question that I want to get to for you. And I want you to think about this. You're a very young dentist, so be thankful for that. You've got a lot fewer gray hairs than I do. And I also met your mama, and so I know, that you're still the baby of the family. So you'll never live that down with me. But one of the things that I want to ask you is, if you're speaking to a young dentist that's coming out into practice, is there an order of needs, if you will, or an order of integration that you would recommend as to how they should incorporate technology into their practice and into their workflows?
My thought process, at least on this, is as a new dentist, when you come out, learn to do the basics well. Understand the why. I think for me, coming out of dental school, I didn't understand a lot of the things that we were doing. Like, I kind of just went through the motions, didn't really understand the why. And so, learning some more, getting that foundation, finding mentors, really helped and continues to help me kind of push the limits. And so having people around like you all has really been helpful for me. That being said, going into the digital workflow, I think some kind of scanner, even if you just bring a scanner in, I think is huge. If you just scan and send to a lab, I think that's a great starting point. You can have a scanner. It's a 3D visual that you can see, a 3D visual that you can show to your patient. And, if something comes back from the lab that doesn't fit, it allows you to test yourself to see why. Is it a lab error? Or is it a human error? Is it something that you did? And so I think that that's a really great starting point from a digital aspect, in my opinion.
All right. What's next?
After that?
Mm-hmm.
Well, after that, we're hopefully going to bring in an iTero scanner too. So
No, I mean, you get a
Oh.
scanner. I mean, is the mill
Oh,
next or
after
is the
that.
printer next?
I think I'd go printer.
Okay, so this is interesting. I I couldn't agree more.
Mhm.
I think that if you start a practice without a scanner, it's a huge mistake. Huge, huge, huge mistake. I mean, of course, you've got to have, as painful as it is, you've got to have some impression material in your practice because at some point in time you're going
Oh,
to
for
need.
sure. Oh, absolutely. Yeah.
But I think you've got to start scanning, and I think you've got to start scanning every single patient. All the scanners these days are color. There's so much value within a scan, even if it's not just if it's not a restorative scan, it's going to allow you to see so much about what's going on in the patient's mouth. Um, I believe that I would have said that next you need to incorporate a mill, but I think I'm going to agree with you and say that next you would have to incorporate a printer
Mhm.
because not everybody's ready to mill per se. Not everybody's ready to mill restorations, and that's okay. I think a mill is now at the point. Scanners and mills and printers, they're all at a price point
Mhm.
that you could have one in your office and not use it on every single patient and still put food on the table. But I think a printer has a lot of capabilities that a mill doesn't. You know, a mill is
Agree.
just a restoration pusher outer, you know,
Right.
whereas a mill is a restoration device, diagnostic aid, pusher outer. There's a lot
For
of
sure.
different things that a printer can do. So really, really look into, uh, you know, what would be next, and you know, in some practices it is going to be a mill, but I think in the majority of practices it's probably going to be a printer nowadays.
Yeah, I think so. I think at the price point at where they're at now, if you had to go one route, I think the printer for sure, and the versatility, like you mentioned, huge, huge. You can do so much more with printers now, and you get upgrades or
Yeah,
updates to
yeah.
digital updates that you can incorporate into those printers in comparison to a mill where you can't.
So, one piece of advice for a young dentist incorporating technology, any final words that you'd like to share with them?
I think don't be afraid to kind of jump in and try things out. Like, if they fail, they fail. Do better next time. Be
Yeah.
be true to your patient. Tell them the facts, tell them the reality of the situation. Treat them right, treat them well. But I think that coming out as a new dentist, we're very timid in trying things. But I think just kind of getting in there, you know, get the training that you need and learn so that way you know what you're doing. But just kind of jumping in there and trying things out, see if it works.
Well, I think the closing thoughts that I'd like to share is that you know you may be more on the public health side and then the academia side than I am. You know, I'm private practice and whatnot, but you can't be fearful. And I think one of the things that we have a lot of common ground, even though we may practice differently. We have a lot
Mm-hmm.
of common ground and a lot of eagerness. But one of the things that we both have a found principle on is our whys and why we do what we do. I think we're both big fans of that. So for those of you that haven't, once again, Simon Sinek's book, Start With
Oh,
Why.
so good. Yeah.
It's a great book.
I
It's a
think it's my
quick
top
read.
top 5 book.
Yeah.
Yeah, for sure.
So start with why. But the other thing that I would say is that the incorporation of technology into your practice really elevates the patient experience. Um, you know, you said something a few minutes ago about, you know, doing something for patients, but when they look at the technology and how we're utilizing in our practice, it really has a profound impact. And it's everything that's being brought to dentistry as far as technology is concerned is all about elevating the patient experience, but also elevating the level of patient care that we're able to provide.
100%.
Yes, it makes our jobs easier, but it elevates the care that we're able to provide. So, really, we're beyond the point of wanting to embrace it. I think nowadays we have to embrace it because it's here to stay. So, I encourage everybody to take the leap, make one technological advancement in your practice that you don't already have, whether you have a scanner and you're trying to figure out what's next, pick up a mill or a printer or a CBCT, but understand your why. Look at the flow of your practice and look at what's going to benefit your team as well as your patients, And that's how you decide what's next. So um, that was an awesome conversation. Thank you
Yeah,
so
I really enjoyed it.
much.
It's so funny, Chad, that neither one of us said hand pieces.
Yeah. Well, it's funny. I know. And you mentioned that in the conversation you sent me before. And I was like, oh, we're totally bringing that up because that was a huge game changer in my practice. So,
yeah, super cool. That's in there somewhere, but I don't think top 3.
So I have a plan. And,
Oh,
when Jeff and JB are back, I think that I want to get you back because I think we need to talk about AI.
okay. Yeah,
All right.
I haven't incorporated that really, but
Well,
I
no.
mentioned briefly a tarot scanner is probably coming too, and with the what is it, Neri?
Neri. Oh,
Yeah.
that's fantastic. We can talk about that all
Oh,
day long.
cool.
Okay,
Yeah.
so Neri and AI and maybe radiology, but there's so many things that we can talk about. But I'm telling you, I think there's so much value in talking about AI with people that have it and people that don't have it, because I'd like to see what, even if you don't have it yet, I want to see what you're hearing about it. I know you know the buzz. So
For
let's
sure.
talk about that.
Okay. Yeah, I'm excited. Let's do it.
All right, folks. Well, everybody have a great night. And thank you, Tanya, for being here.
Thank you for having
Really
me, Chad.
appreciate you. Sorry that I called you part-time at the
Oh,
clinic.
that's okay.
I
We
remind
just
you
need to
that
be.
you wrote that. So,
So many people think I don't work and just make videos, and so we need to clarify that. I do.
well, let me clarify that this is the hardest worker I have possibly ever met in my life. Okay.
Thanks, Chad.
So there you go. Hey, great seeing you, Tanya. Thank you
Hey,
so
good to
much.
see you.
All right.